You're listening to Age to Perfection, where we redefine aging, celebrate every milestone, and empower women to thrive at every age. We're so grateful to have you as part of our community. Don't forget to hit that subscribe button so you never miss another episode. Cheers to being aged to perfection. Hi, everybody. Welcome to another episode of Age to Perfection with Drs. Patel. Today, we are talking about acne scars. And acne scars are stubborn, so I thought we would enjoy a nice stubborn Spanish wine. And
are zebras stubborn?
Yes,
they are.
They are. They're actually one of the more stubborn.
Very fitting. Okay.
But this is called Pico Curado Wild.
I like how you said that. It just rolled off the tongue. Look at you.
But I will tell you, it was recommended and I haven't tried it. And the reason I wanted something that I haven't tried either with you is it's kind of like acne scars. I feel like we learn something new every year. And we've been doing this for so many years now.
And I would agree with you. They are very stubborn.
So cheers.
Cheers to being stubborn. What do we do?
Yes. That's how results happen.
I thought we were talking about each other.
Yeah. We're result oriented.
It's good.
Oh, it is good.
Yeah, it's really good.
Okay, so I want to talk about not fresh acne scars. I know you're in the thick of acne with all your teenagers.
Yeah.
So your house full of teenagers right now. But I want to talk about the people that the hormones have stabilized. We're talking 25, 30, hell, even our 50-year-olds are coming in. And they've already been through the awful pimply years, and some of the lucky few got Accutane. Some of unfortunate ones like me did not get Accutane. Now there's all these things left behind.
Right.
So, and I think one of the reasons I wanted to do this topic is I am very tired of people coming in and be like, I bought a microneedling package for my acne scars.
And it didn't work.
It didn't work.
Yeah.
Do you have anything? Yeah. So I'm like, okay, let's break it down. So when you talk to your patients, how do you break down acne scars?
I try to keep it really simple because, they've already been struggling with it, but we go through kind of the general idea of the different types of scars, right? So there's different types of scars. Each type of scar is stubborn. So just like yourself, I get a lot of patients that are like, well, I tried those things and it didn't work. And I tried this and it didn't work. And really a lot of what they've been trying are touching the surface is what I tell them, right? You're touching the surface. So I like to explain to them that these scars go beyond what you're seeing. Mm-hmm. And that's where the struggle with different treatment styles and different treatment techniques are really what you have to kind of delve into, research and try, So microneedling, for example, because you brought that up, chemical peels, things like that are good, but they're not going to get to the depth of the scar. So, just educating on the different styles, like you said.
How do you, in your mind, break it down? Because I have a system, in my mind.
And I'm the organized one. Okay, let's see. I'm impressed. I don't know if I have an exact system. I think what I do with kind of everything in our field is how old are you now and when did that start? Yeah. So I kind of age the scar.
Yes, because the older the scar, the more stubborn it's going to be.
Exactly. So I kind of go through that process and say, okay, for every such amount of time, I'm probably going to need a combination of X amount of treatments, right? And then I kind of go through the area of skin they're in because I feel like there's a different response in like cheeks versus chin versus forehead based on the thickness of the skin and where the scars are. And then I also assess the color. So is it just a scar or is there a red to it? Or is there a brown to it? Is there some pigmentation? Is there irritation? And so those are kind of the things I process in my mind when I'm going through a patient that's coming to me with acne scars. Probably the top things that I'm looking at.
Yeah, that's usually how I break it down in my head too. And then to me, I actually, I always also tell them, like, there's pigmentation and then there's texture.
Right.
And unfortunately, one doesn't we don't have a magic wand. Right. We have several magic wands, but we don't have one magic wand.
Right.
And it all starts to, you can't take one and do everything with it, right? Unfortunately. So let's break down pigment versus texture. I always chase texture first.
See, and I do pigmentation first. But
there's no
way to wrong. But I think because my big thing has always been like, if your skin looks clear, like, free of blemishes, then you're going to look more youthful, or the scar is going to look better. So I always feel like I'm going to clear, but I can understand the texture too, right? Because if you've got textural issues, then it almost looks like you have a blemish or a pigmentation. So you could do it either way.
I think the reason I started,
but I'm not surprised that we do it the exact opposite.
I think early on in our career, I learned that when I start improving the texture, the spots come out.
Oh, yeah, because there's that makes sense.
And so then I started realizing, okay, I really need to, because there's going to be more spots that are going to come to the surface, and I should just wait.
Right.
And do this pigment last almost like icing on the cake. But like you said, there's no right or wrong answer. And I think when we talk about, let's talk about texture scars. Okay. We know there's a few different types, right? There's box scars, pick scars, rolling scars. And all of those scars are made up of collagen. Right. And I think we drink collagen, we put it in our food, we bathe in it. But there's 3 types of collagen, actually 5 if you think about it. But in our field, we only care about 1 and 3, to be quite honest. And I learned a new thing when I was kind of researching for this podcast is I didn't realize that most acne scars are actually 80% type 1 collagen and only 20 to 30% type 3 collagen. So type 1 collagen is your structure. For those of you who don't know, it is what keeps everything up and tight. And type 3 collagen is your flexibility. And remember, in a healthy skin, you need both, right? You need that flexibility for the skin to stretch out, stretch in, that elasticity. But you also need that rigidity to hold things up. And I think the inflammatory process of acne scarring, and I think that's where you touched on old versus new. And when you're really breaking down acne scars and you're talking about now, how am I going to touch the texture? I think we break down, well, how rigid is that scar? So your most rigid scars, where do you start first?
Oh, I mean, my still go-to all-time favorite, like as far as treatment you mean, is probably radiofrequency microneedling, because I feel like it just helps get to the depth of the scar and the skin and just break up and cause that injury and remodeling so well. That's probably my first go-to for a patient if they're not terrified. That you start talking about microneedling and needles going in the skin, they look at you like, what are we doing?
Well, but then they come back and say, well, I already did microneedling.
Right, but that's a different one. That's just the surface, right? 98% of them are talking about just skin pen, manual microneedling, which I always tell them that's not a bad thing. It's a surface treatment, but if you don't get to the depth of the scar, it'll look good temporarily, but it's not actually remodeling the scar itself.
Right. And box scars live 0.1 to 0.5 millimeters deep, but those are your shallowest. Your pick scars go down to the dermis, past the epidermis down to the dermis, and rolling, and sometimes into the hypodermis. Rolling scars for sure go down into the deep dermis. And I think that's going to be the newer wave. And all the new technology coming out is part of the hard thing with rolling scars and pick scars is, are you really getting that energy deep enough? And you really have to know your lasers to know which one is actually going to get deep enough to remodel those scars, right? What's happening to that collagen?
Which I think your favorite is that we're being right?
Yeah.
I do. Yeah. I mean, what we're trying to do is create an inflammatory reaction. So your body's sending those cytokines to go in and remodel the collagen that's there in the scar.
But isn't that how I got the scar in the first place, is the inflammation?
Well, but this is a healthy inflammation. It's a controlled inflammation. It's an intentional inflammation. We're intentionally causing inflammation.
Yeah. You know, when we tell our patients that doesn't make them any easier to get into the chair.
It's controlled.
And we're learning that control and that finesse more and more. As technology gets better and better, we know now that the newer lasers are coming out to specifically pinpoint down to like the microscopic level to be able to get exactly where that wrinkle is or where that scar is. And we're getting more and more lasers that are controlling the heat inflammation, but still being able to give
that injury.
In the injury, right? And that's the other improvement that we're seeing coming out in the newer lasers. Okay, so we talked about the deep scars, melting them away with radio frequency. And then when they pop up, and then you have your box scars. So what are some of your favorites for box scars?
I mean, ablatives, right? Like anything ablative to kind of help resurfacing. I mean, even those scars are still deeper, right? So the chemical peels, microneedling, again, surface. I sort of do those in combination. I tell my patients microneedling like skin pen or chemical peel is great, but we're going to put that on top of a treatment like a laser, right? Like, so something like erbium, something like a CO2 fractional. Those, in my opinion, are going to be the best for those more superficial scars. They're not really superficial, but because wording it more superficial,
yes,
than your thick scars or your right. Yes. So to me, I feel like the ablative procedures work well for those.
They do, and we both layer both of these procedures together on the same day.
Yeah.
Because we love.
I started adding chemical peels on top of that. Oh, she did. Of course. Hey, where from you though? I'm always doing this little thing. I'm like, okay, if she can do it, I'll do it.
Well, I like to play, but I only do it on the people I have learned your skin, and I know I'm not going to go wrong. I want us to go back to talking about the collagen rebuilding. Mm-hmm. And I think a lot of people don't realize that this is also what's changed in the last year or two. You touched on controlled injury.
Right.
And the next step, now we can do controlled injury. I think the next one, and we already see it, is controlled healing. And we talked about type 1 collagen and type 3 collagen being necessary, but when you add the inflammatory response, they become not healthy collagen. They become unhealthy collagen, right? Then now you have PDGF and you have Regeneron to boost that collagen and kind of shove it down into...
And give it that controlled healing.
Controlled healing, right?
Yeah.
Are you adding it on to... Which one are you adding on? Tell me.
Oh, that's a trick question. I think it's just what I'm feeling that day. I don't know that I have a rhyme or reason. I feel like those products are so new to us as a whole, right? As an industry.
In this industry, yes.
And so I think I just alternate. I alternate and I try to figure out. Now, I do feel like with scarring, since we're specifically talking about scarring, I feel like that for that person, I'm going to reach for the PDGF, right? Because it is really a growth factor. It's really regenerative. If we're talking about what we're trying to do is regenerate the skin into a healthier skin base. So in my opinion, I think the PDGF is going to excel at that as a topical add-on to, radiofrequency microneedling plus an ablative laser, throw some PDGF on there, and hopefully, you're batting a home run for one of your scars. I feel like the Regeneron I'm doing more as a anti-aging treatment.
I agree. As a glow up.
Yeah, specifically for like people that have more textural or fine lines, wrinkles, things that are more age-related changes versus a scarring.
Can I tell you, I feel like the Regeneron has looked better for my red scars.
Yeah.
We're getting that. So that's the next is the pigmentation. But I feel like even the people with underlying rosacea and redness, I feel like have done a little bit better with Regeneron. I don't know why. I can't tell you why.
Yeah.
Maybe it's all the omegas, and I don't know.
Sometimes we just never know why things work the way they work, but they work. So we're going to do it.
So we're going to do it. Okay. Let's talk pigmentation. We have only a short list of acids that work on pigmentation, I feel like, right? What are your...
In relation to acne scars, I always feel like when I do an ablative in combination with the radiofrequency treatment, and then if I'm being brave for that patient and going ahead and doing like a layer of VI peel, right, or PRX or whatever, I do feel like those things help with the pigmentary issues. And the ablative laser really does help. So, I feel like for the most part, I'm reserving anything that's more acidic. Okay, but I state that I had this young lady with an acne acne scars. And her mom was just like, you know, our people. So she was just like, she's young. She needs to
That
get
didn't
married.
go away, but the marks,
Right?
so
she's
bad.
like, she needs to get married and these kind of things, which I totally understand. So and she's moving. She got a job in DC. She's super excited about. And I only have her for 2 months. So I had to figure something out really quickly. You're going to die when I tell you what I did.
Freaky you to say that?
Yeah, because this is something you would do,
Yeah.
not me, but I'm doing it because I got my inner Dr. Patel in, and I was like, how can I make this happen? So I did Ultra 1927,
yeah.
our thulium laser. I did chemical peel on top of it.
Which one?
The VI peel on top of the Ultra.
Did you pre-treat her?
No. And I know. And then I did, she has acne prone skin, but she's one of those that like has really thick skin.
Well, because I realized the chronic inflammation from acne, especially if they have had it everywhere, it thickens their keratinocyte layer is so thick. Nothing gets through.
Yes. So I did that, and then what else did I do? I did a third treatment. I did a combo, and then
Did you do a Pico?
Or just, I did Pico.
I knew it.
I did Pico. I took the Pico laser, and I did Pico. I did Pico, Ultra, and I stuck the VI peel on her. And the fun in the
layers of call, right?
No.
Thank God.
Oh, great. Okay, so, but here's the thing: is I've never seen her before. So you talk about learning somebody's skin. I don't know. I just did it. I was like, I'm going to go for it. I've never seen her. I've never treated her.
Yeah.
But her history is she's been to 3 or 4 other places, and she did.
They did light fields.
Yes,
And
and she didn't peel it, didn't do anything. She did microneedling, right?
But I think you get to do that because you've been doing this for so many years.
I mean, I'm not worried. I saw her about 5 days later, and when she was like, I did a chemical peel and I didn't peel, and then I did this on her and I saw her, she was peeling.
Yeah.
Yeah, she was
I love
excited
it.
about it. I think I'm going to see her next week. I hope we get some good. I hope it works, right? Just for her sake, I really want it to work really.
And this is what I mean by learning something new every year. Like, man, that thick layers, that's hard.
Well, and I do think she would benefit from like Erbiumia, right? And she's a little darker. I would classify her as 5'6" skin type. So I was really scared to do fractional CO2. But I do think if I pre-treat her and do that, she would actually get really good because you're right, that keratinocytes that are so thickened. I mean, you could tell her skin was just like, I could have done something else to her and she'd be fine,
Yeah.
But hopefully it makes an impact. She was peeling. I just hope the scarring goes away.
I think it will.
Yeah.
Sorry,
I got distracted.
But these are all the learning pearls, right? Like, these are all the things that our patients are not going to find on Instagram.
Yeah.
Because nobody's going to share
I
these.
think you would have been really proud of me.
I'm so proud. We're going to discuss this after. So topically, I usually always a retinol because I think over the years, you don't
at home, right?
At home.
Yeah.
And even if you don't have the money to do anything else, get on a retinol.
Yeah.
Because over the years, it will break down that scar.
Yeah.
Retinol over time turns over skin, breaks down that skin. Then that's what we're
keep you younger. So
it's also going to keep you younger. So
it's a win-win.
So why not?
Yeah.
Firming serum.
I love that stuff. I don't know what
I did not realize that that would work on acne scars.
Yeah.
But it works on acne scars.
Well, okay, but if you break it down, it has a polynucleotide in it, right?
Yes.
So it's very similar to like Retinol. It has your growth factors. I mean, it has so many different things in it.
But we've had other things with growth factors before.
And it doesn't work.
And it hasn't worked the
Yeah.
same.
I think it's probably more the polynucleotide.
I think so too.
Yeah.
But I've loved it. And these are all things that I feel like if you are out there with acne scars, there's a couple of really good topicals that you can get on, even if you don't have access to all the fun toy treatment that we do, right?
Well, and like even though it's like, it doesn't matter whether you're talking about acne scars, melasma, rosacea, whatever skin disorder you're dealing with, it's always going to take a combination of things. It's not just treatment. It's things that you're doing at home. It's environmental. It's how much sun exposure you're getting, right? It's a combination.
It's a combination of everything.
Yeah.
And what are your must-have assets like for
My acne patients?
Yeah. Like, I know retinol, but is there anything else that you're
Like Glycolic and salicylic.
do you dip? into that?
I really do like glycolic a lot. You know, I like insulation softener. I mean, I love glycolic acid because I think it's well tolerated. It makes a huge difference on pigmentation. It helps turn over the skin cells. It helps scarring. It's not a strong acid, but it's not a weak acid.
No,
I feel like it's kind of just right, very thin of middle, like easy to tolerate. So in my opinion, I like that. I know there's a lot of people that love azelaic acid for a lot of different things. And lactic I feel like it's just like fluff. It's sorry for the people that like it, but I'm like, it's fluffy, okay? Like, why use it? It's just fluffy.
Yes, because with acne scars, you don't need fluffy.
You need something. Yeah. I think high dose, like high percentage salicylic acid would be really vital too.
If it doesn't inflame.
If it doesn't irritate, yeah. That's why I call it.
What about steroids? You know, Trilumo used to be so popular back in the day, but I don't hear about it very much anymore.
Well, we know that long-term steroid use on your skin is not advisable, right? It can thin the skin, break down the barrier, things like that.
And a couple of my patients have actually had hormonal
breakdown
fluctuations, because of topical steroids, by the way.
I love topical steroids.
I know, but I have a handful that every time will have breaks for bleeding. Every time.
I mean, I'm really cautious where I use it.
So I don't use it on them anymore.
I'm cautious where I use it. I do still continue to use it for PIH or pre-treatment. That's one of my things. If I feel like somebody is kind of at high risk for PIH, especially while we're doing ablative lasers, I'll do it for that. Or post, if someone's having an inflammatory reaction that is causing PIH.
Honestly, I'm just making her do Genesis. I'm like, it's pigment. We don't need to mess with it. We forget about the small pigment lasers that just a series of Genesis.
Genesis helps with it too. Yeah. But I don't mind steroids too. It's not fun.
Steroids are fun.
It doesn't want a little bit of steroid. They just make everything go away so much faster, right? We're in the age of instant gratification. So use sparingly and cautiously and limited.
I use steroids as my training wheels.
Yeah.
Like before and after. If I'm going to do crazy things, then I make sure I just, let's just 3 days before and like a week after. Yeah. And that way I get to sleep at night. Because I like to sleep at night.
Especially your darker skinned individuals.
Yes. Right? Yeah. Do you remember about 10 years ago, we flew to Utah?
Salt Lake City.
Yeah, we did a PRP course because PRP had just come out. And they needed someone for acne scarring. And I remember I had acne scarring in my temples. And we did it, and the plastic surgeon was like, hey, send me pictures of when it heals. And I think I want to end this podcast with the message that with all the toys we have, with all the things that I do on a regular basis, I still have the acne scars. And sometimes you just have to embrace them. And you just have to say, it's not going to go away. And if you are a parent of a teenager out there, just invest in the skincare, invest in the prevention.
Yeah. Early.
The earlier the scar, the better, right? The earlier the treatment, the better.
Right.
Period.
Yeah, I agree.
Thank you for tuning in.
Disclaimer. The information provided in this podcast is for educational purposes only and is not intended as medical advice. Please consult with your qualified healthcare professional to determine the best treatment options for your individual needs. Results may vary and all procedures carry some level of risk. Always make informed decisions in consultation with a licensed professional.